along with our radio area, we also have a section for TV sets. This set is from the late 40s, early 50s, and that's a home unit. This is one of the first portable TV sets. We transitioned from this early portable to a much later portable set, and then finally our current TV sets.
PCN Tours presents From the Factory. Stay home and go on tour with a manufacturer who is helping their community through this trying time. Hear directly from employees on the front lines making masks, hand sanitizer, and other products needed to combat COVID-19. From changing operations to creating new products, PCN is dedicated to telling the story of how companies in your backyard are adapting. Stream free on the PCN Select app and PCNTV.com.
Help us do that. KATE stands for Community Accessible Testing and Education, KATE. And it is the result of a partnership with the Latino Connection, the Pennsylvania Department of Health, Highmark Blue Shield, and Independence Blue Cross. We share a unified purpose of building healthy communities through access to care and education. When someone visits the KATE mobile unit, they will receive a COVID-19 test, as well as education about how to stop the spread of this contagious disease. The lab test will be processed actually in our state lab in Exton, Pennsylvania, for a quick turnaround of 24, at the most 48 hours. We know that across the country, minority and underserved communities have been hit the hardest by COVID-19 because of problems that existed actually long before the pandemic came to our shores. It is the social determinants of health and health equity issues that lead to poor health outcomes in these communities. And these have been exacerbated during the global pandemic of COVID-19. This partnership is a step in the right direction to breaking down those barriers to our vision at the Pennsylvania Department of Health of a healthy Pennsylvania for all. It is also furthering the Wolf administration's commitment to creating pathways to health equity for anyone living in Pennsylvania. Throughout the pandemic, the COVID-19 Response Task Force for Health Disparity, led by Lieutenant Governor Fernandez, has been instrumental in identifying needs within communities and helping us meet those needs. In fact, it is because of this task force that we have been able to build such strong relationships with organizations like the Latino Connection. The Lieutenant Governor's Task Force and our own Department of Health Equity Task Force both find solutions to issues related to COVID-19, including providing testing to underserved communities. As I have said before, with this novel coronavirus, COVID-19, no one is immune. Bringing testing to communities that otherwise would not receive it is a way that we continue the fight against this dangerous virus. So, if you can't make it to a KATE tour stop and need to be tested for COVID-19, there is an interactive map of testing locations on our website at health.pa.gov. And as always, if you have any questions about your health, please contact your healthcare provider. Getting a test is a very important way to stop the spread of this virus. You are also stopping the spread when you wear a mask. You are stopping the spread when you avoid large public gatherings. And you are stopping the spread when you use hand sanitizer and wash your hands frequently. Our actions as a community together continue to impact us all and allow us to do the things that we would normally do, such as staying at work and getting our children back to school. So as always, stay calm, stay alert, and stay safe. Thank you. I'd like to turn things over to George Fernandez of the Latino Connection.
Thank you, Dr. Levine. It's a pleasure to have your partnership for this amazing initiative, Kate. Hola. Words cannot fully express how grateful and excited I am to be here today, representing Latino Connection and the unveiling of Pennsylvania's first ever COVID-19 mobile response unit. The unfortunate reality we face today is that the suffering of our most vulnerable and underserved communities has risen to a whole new level due to COVID-19. For those who already had an uphill battle against food disparity, food nutrition, chronic illness, lack of education, and lack of adequate health care, they are now facing COVID-19 with very limited resources to protect themselves and the ones they love. There are substantial and extensive facts that back up the claim that non-white populations have died from COVID-19 at disproportionately higher rates than white populations in nearly every state in the US. Latino Connection feels passionately that something must change, and that time for change is now. In order to solve healthcare inequality and reach our vulnerable and underserved communities, we need to meet them where they are. Quite literally, we need a COVID-19 movement with wheels. From Latino Connection's unwavering determination to do more for our communities, Kate was born. Kate stands again for accessible, community accessible testing and education, and is a mobile unit equipped to travel across the Commonwealth, providing COVID-19 testing and resources to everyone, regardless of income or health insurance. The unit has more than already 30 stops on the calendar in the coming weeks, focusing on counties with the highest underserved populations. Just yesterday, Kate made her first official stop in Littlestown, Pennsylvania, visiting the local Y, and will continue on to York, Shrewsbury, and Lancaster this week. And this is just the beginning. I urge everyone to take advantage of this incredible community resource. We can all benefit from COVID-19 education so we can protect ourselves and the ones that we love. Through Kate, it is our goal to share facts to erase fear. More information about Kate and a list of upcoming stops can be found online at katemobileunit.com. I wish to express my deepest gratitude to Secretary Levine, the Department of Health, our friends at Highmark Blue Shield, and our new friends at the Independence Blue Cross Foundation for sharing in my vision for sharing and bringing healthcare equality to low-income, vulnerable communities. Dr. Levine, to stand with you today gives me great pride, far beyond our initiatives to combat COVID-19. From the moment you stepped into the role of Secretary of Health, you have navigated immense challenges and scrutiny with courage and grace. I know that your days start early and they end very late. You are faced with a constant stream of hard decisions, and that everything you do is truly for the health and safety of all Pennsylvanians. On behalf of Latino Connection, the Latino and the LGBTQ community, I wish to thank you for doing all that you do and for being who you are. Thank you very much. At this time, I'd like to introduce our nurse partner, Miss Maria, from the Federally Qualified Health Centers, one of my favorite Welsh Family Health Centers.
Good afternoon. Dr. Levine, thank you. Thank you for inviting us here. My name is Maria Kelley. I am a nurse practitioner at the Welsh Mountain Health Center. Today, I am here along with our CEO, Jackie Concepcion. I'm here to discuss the process of COVID-19 test administration and processing of results through the KATE initiative. At the KATE stops, where Welsh Mountain is the test provider, our site manager and our office manager coordinate staff to manage the event. 2 bilingual medical assistants will be assigned to help on site to accommodate our non-English speaking community members. Our social workers will also be on site to help with registration, drive-up testing, and curbside walk-up testing. Staff will remain vigilant and ensure that social distancing is maintained at all times throughout the event. Nasal swabs will be obtained from all who wish to be tested and then delivered by courier to the Pennsylvania Department of Health. Results are typically returned within 24 to 48 hours to Welsh Mountain, where we then organize the results and notify those tested of both positive or negative results. A log is kept of all the tests performed, the test results, and the date of notification. Those who can be tested include anyone with symptoms, known exposure to COVID-19, anyone attending university or colleges, a job-related testing request, or even travel requests. No prescription is needed. You will be tested regardless of having health insurance. A form of identification is required to place on the registration forms. In addition to testing, KATE will also provide demonstrations for things such as mask wearing, hand washing, educational materials, and free COVID-19 supplies such as masks, hand sanitizers, and other resources to inform the community and to protect them from the spread of the virus. I would like to express my deepest thanks to all of the organizations who have partnered to make KATE Mobile Testing Unit possible. You are helping Pennsylvania reach its goal of providing COVID-19 testing and education to those in vulnerable communities. I strongly urge anyone who is showing COVID-19 symptoms or has a known exposure to be tested. And one of the most accessible ways to do this is to visit a KATE tour stop. A list of upcoming events can be found at the website www.katemobileunit.com. Thank you. I would like to now introduce Kathy McKenzie, Vice President of the Community Affairs at Highmark Blue Shield.
Thank you, Maria. Good afternoon, everyone. I'm Kathleen McKenzie, Vice President of Community Affairs at Highmark Blue Shield. This community engagement effort is excellent use of Highmark's charitable dollars as we contribute to the most important issue of the day in Pennsylvania and across the country. Broader accessibility to COVID-19 resources across the Commonwealth will help and flatten the curve. We cannot merely target the most concentrated areas in the state, but we'll also focus on key pockets where health resources are limited. We know that socioeconomic factors like lack of ability to providers and access to health education affects up to 80% of an individual's health outcomes. It's no different in a pandemic. In fact, for this pandemic in particular, it has even further pronounced the critical needs of Pennsylvania's most vulnerable communities. Populations with a lack of provider access and health education, which often include minorities and our immigrant populations, are at most risk for COVID-19. At Highmark, we're committed to supporting efforts like this, which bridge gaps in health disparities and break down the socioeconomic barriers so that the regions we serve will not further spread coronavirus. I'd like to thank our partners at Penn State Health, St. Joe's, who I know are helping testing in some of the communities in Central PA. And I'd also like to thank our dear friends at Latino Connection, who worked tirelessly to get this work done. Also, our friends at Independence Blue Cross, who are here today. Dr. Lorina Marshall Blake, thank you. Dr. Blake at the Foundation. Blue Cross, Independence Blue Cross shares Highmark's commitment to supporting public health initiatives. And most importantly, we would like to thank Governor Wolf and Dr. Levine for their outstanding leadership during this time and for their commitment to health equity and partnerships which strengthen the communities we serve. And with that, I return you back to Dr. Rachel Levine. Thank you.
Well, thank you very much, and we're available for questions. Yes?
Somebody just have to show up and say they want to get tested, or should they have symptoms? Who should be using this?
Well, I believe that she had talked about that really anyone who has symptoms or an exposure to COVID-19 or also needs it for work-related or other types of purposes can get tested. In terms of just showing up, do you need an appointment? No, you just show up. You just come to one of the testing sites, and they'll make sure that everyone is social distance outside waiting to come in. Thank you. Yes?
You know, given the size of Pennsylvania, the population and the actual geographic size of the state, it seems a little hard to imagine that this one vehicle and its staff could make that much of a difference. Could you please give me an idea of which areas it will focus on and how active it will be?
Well, it's
and
going
if
to be...
there's plans to have more of these.
Sure. Well, it's going to be very active. Would you like to comment on where you're going? Sure.
Absolutely. Yeah.
Why don't you come?
Sure.
We'll switch.
That's a great question. Thank you so much. Kate is 40 feet long, 14 feet tall, and 10 feet wide. And she currently has over 30 mobile stops that are currently scheduled from now through the end of September. So she's a very busy girl. And she will be making stops again in 16 counties with a focus in South Central and Southeastern Pennsylvania. So some of the counties that it'll visit are Adams, York, Lancaster, Lebanon, Delaware, Philadelphia, Northampton, Lehigh, as well as Erie and Allegheny. There are plans to continue this, and in order for us to do that, it's possible through our partnerships with the Department of Health, as well as Highmark and the Independence Blue Cross.
Will it give me an idea of how much time it will spend in the major metro areas to say more of those, I think somebody used the terms pockets.
So each stop is already pre-scheduled. It's either pre-scheduled at a local church facility, at a local YMCA organization, or at a local community center. It is currently scheduled to be in Philadelphia and its surrounding counties for roughly about 2 weeks in the month of September. And after those 2 weeks of being in the city of Philadelphia and its surrounding counties, we plan to visit the other counties across the state of Pennsylvania. I encourage you to visit the website to check out the list of stops. It's katemobileunit.com, and we expect to reach a minimum of roughly about 6,500 people, close to 10,000 people, around educational resources. They will be receiving a branded mask just like this one today. These masks were graciously donated by our friends at Highmark. Thank you, Kathy. Along with additional resources, mini bottles of hand sanitizer, water bottles, and COVID-19 literature.
And will you just address like the cost, like any cost that there is to anybody who comes for a test or whatever?
So there is no cost to attend and to get tested on Kate. If you do have health insurance, the provider is available to also bill the insurance company, but there is no cost to be tested. Yes.
Waiting for it. I was going to ask, when did the need for this? When did you guys identify that there was a need for this unit? And roughly how many people do you anticipate every day that this is out will walk through the doors, so to speak?
That's a great question. Thank you so much for asking. So we identified the need. We reached out to our friends at the Department of Health. Truly at the peak of COVID-19, the need was identified sometime in early May. And from May up until today, up until mid-July, we've been working diligently with the Department of Health and its executives and other partners at the state level to make this happen. And we came to an agreement sometime in July. So in less than 3 weeks, 3 to 4 weeks, we were able to get this basically on the road. Again, our first stop was yesterday in Littlestown, Pennsylvania. And we expect to reach roughly about 220 to 250 people per day.
Will the staff be the same traveling on this?
It will not. So they also have lives and kids to take care of, unfortunately. No, I'm kidding. No, but it's not the same staff. The staff that you see here today, many of them are certified community health workers and have been doing mobile units type of outreach for over 3 years. Our team at Latino Connection and Community Partners have roughly about 30 team members that will be taking turns and being what we call event leads, along with community health workers who will be out on the road accompanying Kate.
My last question, what seems to be the greatest barrier in helping those communities when you find that they have COVID-19, when members of those communities have COVID-19, what is the greatest barrier? Is it a lack of education, a lack of resources?
It's both, actually. It's lack of education and lack of resources. When we're able to put a mask that's not disposable into their hands, when we're able to get information in front of them, how to care for someone in their home if they're sick, what is isolation, what is physical distancing, and essentially connecting them to local resources. Kate will be partnering with local providers, local FQHCs, and local major hospital systems, such as Welsh and such as Penn State St. Joe's. And it's really finding them a medical home that they can go to should they have any other needs that arise around COVID-19.
This is for both of you and Secretary Levine as well. You mentioned that sharing facts to erase the fear. What is the greatest fear that you're trying to address with Kate? And then I'll have a follow-up as well.
Yeah, I think the greatest fear that we're looking to address with Kate is truly letting people know that this is a virus and it has no eyes. It doesn't have any limits. So letting people know that this is what I like to call our new normal. So it's really about moving forward with life while applying physical social distancing and truly getting resources like a mask into the hands of those low-income, vulnerable communities. Dr. Levine, would you like to comment?
So in relation to your question, I think often what people fear most is the unknown. They hear about COVID-19 in the Latino community, the Hispanic community. They might not be speaking the language in terms of the news reports, etc. And so I think that people fear what they don't understand, and then through education and appropriate testing that we can address that fear. And just in terms of health equity, I think it's critically important to note the health equity issues and the quote-unquote social determinants of health. The social determinants of health are things that impact our health in our society that we do not usually think of health related. They're not health care necessarily. But from that perspective, economic opportunity is a social determinant of health. It's a health issue. A living wage, the minimum wage, an increase in the minimum wage is a health issue. Education is a health issue. Transportation is a health issue. Housing is a health issue. Of course, nutrition and the environment are all health issues. And so COVID-19 has kind of stripped bare what we already knew about health disparities. And this is just one way that the Pennsylvania Department of Health and the Wolf administration are addressing these very important issues. I know you had another question, though.
Yes, ma'am. What would you say to the immigrant populations that may be in the Commonwealth illegally, that may be a fear of them to not come get a test because they are in the Commonwealth illegally? That's not a preclusion to get a test, is it?
That is not a preclusion to get a test. I mean, we want anybody to have access to testing. That's how we protect the public health. And so that would not be an issue, correct? Not an issue. If someone has symptoms and needs to be tested, they need to be tested. That's how we stop the spread in our communities. Yes.
Secretary Levine, earlier today, Governor Wolf reiterated his call for the legalization of recreational marijuana to help fund programs that will overcome the economic devastation of COVID-19. What does the state's health secretary feel about the legalization of recreational marijuana,
Sure.
given that there are a number of addiction folks in the addiction community who are concerned about that?
So Governor Wolf has articulated, and this is not different than what he articulated before, is that Pennsylvania needs to take a really serious look at recreational marijuana for adult use. And that would be from a social justice point of view in terms of individuals that have been incarcerated for marijuana, and also now, especially in terms of the economic outlook and in terms of the budget. And so I know the governor and the lieutenant governor have outlined that support, and I understand the reasons why they're doing that, and I think that I agree in terms of adult use of recreational marijuana from those two perspectives.
However,
Yeah.
so you just enumerated social justice and economics, and we can agree, Secretary.
I understand.
What do you feel about the health of recreational marijuana being legalized in Pennsylvania?
Well, so I have been concentrating on medical marijuana. We have a very robust medical marijuana system. The governor had said before is that when the medical marijuana program was fully implemented, that would really be the time to consider recreational marijuana. Other public officials had said that as well. Our medical marijuana system is fully implemented. We have just approved our 91st dispensary. We have approved the grower processors, the expansion of dispensaries, and we have now approved all of the clinical registrants for our very important academic clinical research program to learn more about medical marijuana. So I think that, as the governor said, now is the time. Others? Yes.
Secretary, can you address timing of testing as far as both public and private? Are there any backlogs that are concerning at any levels? What's the typical turnaround on testing right now?
So Pennsylvania is doing much better in terms of the turnaround time for results from COVID-19 testing. Previously, some of the commercial laboratories had significant backlogs. They do not have those backlogs now. They have expanded their capacity, and so LabCorp and Quest have about 2 or so day turnaround time. Many of the other commercial laboratories have 2-day turnaround time, as well as the hospitals and health systems, and our lab in Exton, 24 to 48 hours. So we're doing much better in that regard. Where there are still challenges, as I've mentioned before, are in getting the reagents, the chemicals, particularly for those hospital and health system laboratories for a number of their platforms. We have actually sent a letter to our congressional delegation to sign on to, and that would be a letter to Secretary Azar, asking them to really look at Pennsylvania and in terms of access to those needed chemicals and reagents, so that we can continue to do the testing we're doing now through our hospitals and expand the testing. That is the current consideration that we're concerned about.
And then following up on that, where is Pennsylvania in the process of approving a rapid test? Right now we're not. Maryland is right on the border. Where do we sit, and kind of how is the process to make that a possibility?
Well, there are a number of different types of rapid tests, and we don't approve the tests. It's actually the FDA and the federal government that approve those tests. The federal government and CMS, the Center for Medicare and Medicaid Services, will be sending to all of our nursing homes one of 2 rapid antigen testing, and we will work with them to get them up and running so that we can continue to expand our testing in nursing homes. So that's going to be through the federal government. But we're looking for companies such as OraSure, and the Department of Community and Economic Development has had a loan out to OraSure, as we had a press conference about 2 weeks ago. And they had said that they're hoping that their tests would be available in the 4th quarter, so before the end of the year. That's the type of test, more and more of those type of rapid tests, probably antigen tests that have good sensitivity and specificity that we need more of, and we're looking forward to OraSure's tests coming to market. Thank you so much. Thank you for being here.
Lincoln put on the table, how can we, he said, let us try to experiment with Washington, D.C. Let's see if we can institute a plan where we can get all of the black people who are free out of Washington, D.C. into some African country. And he allotted money and resources to really, study